Let's see an NCLEX RN video based on care for patients with skin disorders. A young woman comes to the health clinic of a local college complaining of vaginal burning and pain on urination. Her serological testing was positive for HSV1, herpes simplex virus 1. The woman says, "I can't have herpes because I haven't had intercourse yet." Which statement would be most appropriate in response to this patient? HSV1 causes ulcers on the lips or mouth. There may be a mistake on your blood work. You may have times of shedding the virus when you have symptoms similar to what you are experiencing now. HSV1 can cause ulcers on the lips or mouth, but can also cause genital lesions on someone partaking in oral sexual activity. Have you had any sexual contact like this? When you decide to have sexual intercourse, wearing a condom will reduce the risk of transmitting the virus to your partner. So here, the most appropriate treatment in response for this patient is HSV1 was identified as the cause of genital herpes in 71.2% of all the subjects. So HSV1 can cause ulcers on the lips or mouth, but can also cause genital lesions on someone taking part in oral sexual activity. Have you had any sexual contact like this? The nurse in the intensive care unit is evaluating a critically ill patient who has a flat erythematous rash surrounded with small satellite lesions between her skin folds under her breast and her groin. The nurse knows to monitor this patient for clinical manifestations of which disorder. Here the main point is the patient is a critically ill patient. So is it necrotizing fasciitis, systemic bacteremia, pseudomonas infection, systemic candidemia? Complications of fungal infections such as a systemic candida infection occur when they are not treated promptly and are allowed to proliferate, especially in the critically ill and immunocompromised patients. Which is a common injury that is caused by applying tape to the fragile skin of an elderly patient. Skin tear, abrasion, laceration, ulcer. Skin tears are traumatic wounds usually caused by minor trauma that primarily affect the elderly. Minor trauma in the elderly can include injuries involving wheelchairs, bumping into objects, transfers, falls, and tape removal. A 78-year-old woman has had a history of an open stage 4 pressure ulcer for 6 months. What is the patient at high risk for developing? So the stage is stage 4 pressure ulcer. Hypergranulation tissue, necrotic tissue, osteomyelitis, eschar. A clinical diagnosis of osteomyelitis is made based on the presence of exposed bone. A patient who has had surgical debridement of a necrotic abdominal wound that will heal by secondary intention will require which treatment? Serial surgical debridements followed by skin graft coverage, wound dressing changes until the wound closes, coverage by myocutaneous flap, suturing the wound closed within 7 days. With secondary intention, the wound is left open and allowed to fill in with granulation tissue. Often these wounds are packed with gauze and changed daily. So here wound dressing changes until the wound closes. Nurse in the emergency department is triaging patients. Which patient requires immediate attention? A 16-year-old with a laceration that was sutured closed 3 days ago that now has erythema extending 2 centimeters beyond the suture line. A 30-year-old patient with an open sacral pressure injury with exposed bone with purulent exudate. A 48-year-old patient with an indurated erythematous area on his thigh who is complaining of 10 by 10 pain and has had a fever for 24 hours. A 60-year-old patient with diabetes mellitus who has a nail embedded in his foot because he could not feel it in his shoe. So here the 48-year-old patient with indurated area of erythema complaining of 10 by 10 pain and fever for the past 24 hours is displaying clinical manifestation of infection that could require immediate surgical evaluation for surgical debridement. Delaying treatment would result in more tissue loss and death. Which statement made by a patient who is currently asymptomatic with an HSV-2 infection indicates the need for more education about the disease? It's okay to have intercourse with my partner as long as we use a barrier method of protection and I take my antiviral medications. It's more likely that I could spread the HSV-2 infection if I have sexual relations when I have open ulcers and pain. When I get pregnant, I'll be certain to tell my gynecologist about my HSV-2 infection. I understand that I could still transmit the virus if I don't have symptoms. As a nurse counseling the patient in the option 1, it is okay to have intercourse with my partner as long as we use a barrier method of protection and I take my antiviral medication. You must be certain that the patient understands that the likelihood of transmitting the HSV-2 virus is much higher during periods of viral shedding, even if she takes her antiviral medications and uses a barrier method of protection. Therefore, you must also be certain that she can recognize the clinical manifestation of viral shedding. Taking the antiviral medication does not cure HSV and does not reduce the risk of transmitting the virus, but may decrease the frequency and severity of outbreaks. This patient needs more education about the disease. A mother brings in her 8-year-old child because of a new rash of annular patches, raised borders and central clearing. What should be done first? Obtain a scraping of the rash for KOH microscopy. Explain to the mother that this is probably Tinea corporis and an antifungal ointment will successfully treat it. Obtain a focused history to include medications, activities in which the patient partakes and any history of skin disorders or fungal rashes. Explain to the mother that the rash will subside on its own. The diagnosis of tinea infections can be made with a focused history, physical examination and potassium hydroxide microscopy. Certainly, obtaining the skin scrapings for KOH microscopy is important to confirm diagnosis, but as with all healthcare visits, obtaining a history should be completed first. An 18-year-old with psoriatic plaques on the elbows, knees and legs have been successfully treated with a combination of therapies including phototherapy. Because the patient is an avid soccer player and expects to receive a college scholarship next year, Which information is the most important aspect to teach at this time? The importance of knowing the clinical manifestations of psoriatic arthritis, that is soft tissue swelling, limitations of movement, because as many as 30% of those who have psoriasis develop psoriatic arthritis. The importance of adhering to his medication regimen, the importance of finding a support group to help cope with stress and anxiety that can develop as a response to treatment and can exacerbate the disease, the importance of using sunscreen while outside. Patients with psoriasis are at higher risk of developing non-melanoma skin cancer, especially if they have a history of utilizing phototherapy. Also, teaching the patient to do monthly skin assessment on himself or herself to monitor for new lesions or changes to existing ones. So here we need to teach about the importance of using sunscreen while outside. The nurse correlates the use of KOH testing to the definitive diagnosis of which skin disorder: bacterial infections, herpes simplex, fungal infections, psoriasis. Potassium hydroxide or KOH microscopy, which has a 76.5% sensitivity and 81.6% negative predictive value, makes it more sensitive than a fungal culture. So for fungal infection, this can be used as a definitive diagnosis. The nurse is admitting a patient to the unit who is a paraplegic and has a history of healed sacral pressure injuries verified by the large scars on the sacrum. What action should the nurse take first? Spread on a moisturizing lotion to the sacrum. Place a dressing such as a silicone foam dressing over the scars. Place the patient in a sitting position to keep pressure off the sacrum. Help the patient choose the most nutritious foods on the lunch menu. In the maturation phase of wound healing, granulation tissue matures into a scar where collagen synthesis and degradation continue for 2 years. The tensile strength of a scar will only become 80% of normal tissue. Therefore, placing a silicone foam dressing will protect the scars from the effect of shearing. In completing a skin assessment, the nurse correlates erythema, redness and warmth to which phase of wound healing: hemostasis, inflammatory, proliferative and maturation. The main function of the inflammatory phase of wound healing is to remove the debris within the wound. This phase begins within the first 24 hours after injury and can last up to 2 weeks for an acute wound. The clinical manifestations or characteristics of the inflammatory phase include edema, erythema, heat and pain, and visible necrotic tissue in the wound bed. Which position is best to reduce the risk of skin tears in an immobile older adult patient? In a side-lying position, foot of the bed elevated to no greater than 15 degrees, in a chair with feet on the floor, head of the bed elevated not greater than 30 degrees. With aging, the rete flatten between the dermal epidermal junctions, making it more susceptible to tearing injuries from external shearing forces. Positioning a patient with head of the bed no greater than 30 degrees. It minimizes the risk of patient's body sliding down the bed, increasing the shearing forces and trauma to the internal tissues and capillaries. So we need to position the patient with head of the bed elevated not greater than 30 degrees. The nurse recognizes that pressure injuries is most probable in which areas in the patient positioned in a supine position: occiput, nares, behind the knees, sacrum and heels. The occiput, ears, scapula, sacrum and coccyx, ischium and buttocks, greater trochanters of the hips and the heels of the feet are affected when the patients are positioned in a supine position. So occiput, sacrum, heels. Pressure to the nares is associated with nasogastric tube placement, and pressure to area behind the knees is usually due to pillows or other objects used for position. A patient fractured a hip 1 week ago and is now being admitted to a rehabilitation facility for physical therapy because of difficulty ambulating. During the admission skin assessment, the nurse notes an area of non-blanchable erythema on the sacrum. What is the nursing priority at this time? Order a redistributing mattress for her bed. Consult the nutritionist for a complete nutritional assessment. Perform and document the admission skin and risk assessments. Apply a hydrocolloid dressing over the area to protect it from further trauma. Non-blanchable erythema is considered a stage 1 pressure ulcer. Any evidence of pressure on the body of the patient being admitted to a healthcare facility must be documented on the admission skin assessment, or the institution could be held responsible for causing it and may not get reimbursed for treating it. So the answer is perform and document the admission skin and risk assessment for any pressure ulcers. The other three answers are important and should be instituted, but the admission skin and risk assessment must be completed at the time of admission. Which individual is at greater risk for developing skin cancer? A fair-skinned, blue-eyed teenager who works outside in the summers, uses sunscreen with sun protection factor 50 and wears long-sleeved dark shirts. A woman with a medium to dark complexion who applies sunscreen once in the mid-morning and afternoon while she is playing tennis. A 10-year-old child who plays outside in the early morning and late afternoons and uses sun protection factor 30. A surfer who wears a wetsuit with long sleeves and legs and applies sunscreen to his face periodically throughout the day. Anyone with any skin tone is at risk for skin cancer due to the exposure of UV radiation. The tennis player is applying sunscreen 1 to 2 times during the day. Sunscreen should be reapplied at least every 2 hours and more frequently if perspiring. The best ways to decrease damage from UV exposure is to avoid the sun from 10 a.m. to 4 p.m. Use long-sleeved shirts, wide-brimmed hats, and sunglasses. What should the nurse teach the patient to expect during and following cryosurgery for the removal of a basal cell carcinoma? You may experience some discomfort during and immediately after the procedure. Local wound care may be required because of minor skin sloughing in the next few days. You will not have any pain with this procedure and need to see your provider only if complications develop. You may experience some discomfort during the procedure, but there is no follow-up care required. You will receive a local anesthetic just prior to the procedure. In the next few days, you may experience burning and itching at the site. Teaching the patient what to expect prior to and following a procedure will alleviate anxiety. Cryosurgery causes some minor discomfort during and just following the procedure due to thawing of the tissues. Skin sloughing and minor local wound care may be required in the following days, but cosmetic results are good. So you need to tell, you may experience some discomfort during and immediately after the procedure. Local wound care may be required because of minor skin sloughing in the next few days. Parker is a 42-year-old man with a 20-year history of T10 paraplegia from a skiing accident who presents with a left ischial pressure injury with these measurements. His wound started about 5 years ago after a boil was opened and drained. He had debridement surgery in the past but was disappointed when this created a larger wound that still has not healed. He has never been told that he has osteomyelitis before. He is currently packing gauze in his wound and changing the dressing 1 to 2 times daily. There is undermining of 2 cm from 6 o'clock to 10 o'clock round the wound edge. Wound edges are rolling inward. The base of the wound is not visible. When probing the wound, the nurse feels exposing or the rough ball. Exudate is thick, yellow and malodorous. The packing in the wound is saturated, as is the secondary dressing over the top of the wound. The peri-wound skin is intact and erythema extends greater than 5 cm from the wound's edge. No induration or hardness is palpated along the peri-wound skin. He has had night sweats over the past 3 nights but has not taken his temperature. Mr. Parker has no comorbidities. He is on a strict bowel regimen where he uses an enema every other day to be continent of bowel movements. He catheterizes himself several times a day. He is an accountant and spends much of the time in his wheelchair. He has a pressure reducing cushion on his wheelchair but does not do his push-ups as often as he should. He does not have a special mattress at home. Mr. Parker undergoes extensive wound debridement to remove necrotic tissue and bone. Initially, he does not want to undergo reconstructive surgery for fear of a larger wound that will not heal. Advanced wound care products applied by highly specialized nurses are used to attempt wound closure by secondary intention. After 1 year without wound closure, Mr. Parker decided that he will undergo debridement and myocutaneous flap reconstructive surgery for his ischial pressure injury. He does well perioperatively and is transferred to a rehabilitative hospital where a low air, low mattress is used along with complete avoidance of lying or sitting on the surgical site for 4 weeks. A small area of the incision dehisces. However, with local wound care and continued offloading of the site over the next 2 weeks, the area heals. Mr. Parker's wife has been his advocate and support throughout his hospitalization and treatment. She delightedly makes certain all of the necessary therapies are in place and that he is adhering to orders. Mr. Parker receives nutrition counseling, physical and occupational therapies while in the rehabilitative hospital, which helps him to maintain his upper body strength, which is needed for transfers in and out of bed and his wheelchair. Also, he adheres to the recommendation of doing push-ups. Paraplegic patients in wheelchairs should lift their bodies off the surface of wheelchair cushion every 15 minutes. He has a pressure redistributing cushion on his wheelchair and a special mattress in his home. He is able to return to work and live a full life without an open wound, something he has not done for more than 6 years. So this is the case of Mr. Parker. The nurse is preparing to admit Mr. Parker to the rehabilitation unit following his hospital stay for his myocutaneous flap surgery. Which action should the priority in preparing for his arrival? Having his favorite food available to help him maintain a healthy nutritional status, having a bed available for his wife to spend the night, having the appropriate mattress on his bed to redistribute pressure, having advanced wound dressing for highly exuding wounds available. Mr. Parker just had debridement of his wound with myocutaneous flap coverage. It is imperative that the appropriate pressure redistributing surfaces are available to him immediately upon admission to the unit, as pressure can cause breakdown of the flap with potential loss of tissues resulting in an open wound and possible infection. He desperately wants his wound to heal so he can regain his quality of life that has been negatively affected by the wound over the past 6 years. The wound was surgically closed, so there should not be a drainage from the incision. Which priorities should be implemented early in the treatment plan for Mr. Parker? maintaining upper body strength, performing full passive range of motion exercises to his lower extremities 3 times daily, maintaining his contact with work, email to facilitate his eventual return to work, getting out of the bed to his wheelchair and going outside. It's important for him to maintain his upper body strength while in rehabilitation so that he can perform his wheelchair push-ups and eventually transfer himself from wheelchair, bed and car. The push-ups help with pressure relief, and having good upper body strength for transfers decreases the risk of dragging his weight from surface to surface, increasing the negative effects of friction and shear. Excessive full passive ROM exercise may actually cause damage to the new flap. Since this was an ischial pressure injury, it was necessary for Mr. Parker to avoid sitting on the surgical side for several weeks to minimize the effect of pressure. In what position is Mr. Parker at least risk of increasing pressure to the ischial muscle flap? Lying on his left side, lying on his right side, sitting up in bed at a 60-degree angle, sitting up in bed at a 45-degree angle. Pressure over the left ischial area would be reduced with him lying on his right side with pillows to facilitate proper positioning. Sitting up at angles greater than 30 degrees increases the effects of friction and shear on the body. While eating, he actually laid on his right side at an angle of less than 30 degrees. This can only be done with a fully alert patient who has no difficulty swallowing. The nurse is teaching Mr. Parker about wound healing, which statement by him indicates that the teaching was effective. I will deeply massage my muscle flap daily to increase circulation and speed healing. I will make sure I get a mattress overlay at home so I don't need to worry about changing positions during the night. I will be sure to increase my intake of lean meats and protein. I will go on a diet when I am discharged because I have gained so much weight over the past few years. Wound healing requires increased protein and calorie intake. Massaging of the flap would be traumatic and may cause tissue separation and loss of the flap. Even though a mattress overlay should be obtained, he still needs to be conscious about repositioning himself to avoid prolonged pressure over one area. Caloric need increase with wound healing, so dieting may not be recommended at this time. He should see a nutritionist to develop an appropriate diet for his needs. So he should increase his intake of lean meats and proteins. Which activity would compromise the healing of Mr. Parker's new flap? Smoking, wheelchair push-ups, incontinence, participating in physical therapy, increased fluid intake. Nicotine is a vasoconstrictor that can deprive the healing wound of needed oxygen. Wheelchair push-ups are an essential way that paraplegics relieve the pressure on the ischium while sitting. The enzymes in feces and/or urine can cause skin breakdown and inhibit the wound healing. It is essential for the patient to participate in physical therapy to maintain upper body strength and to establish proper body mechanics for transfers. Ensuring adequate fluid intake is important to healing. So here the activities that compromise healing are smoking and incontinence. Hope you understood this video. Thank you so much. Keep watching.